The Boise State Adult Gerontology Nurse Practitioner Program would like to thank you for volunteering to precept a nurse practitioner student. This is a summary of the contents of the Preceptor Manual. We hope you will review it in its entirety and reference it with any questions you may have. Contact information begins our review. This information is contained in the electronic version of the manual you received. Please retain this information for future reference. We will pause to allow you to review the mission, vision, and philosophy of the AGNP program. Our curriculum is organized from simple to complex. We begin by building a foundation upon which the education process can grow. Students grow as they transition from faculty-facilitated to student-directed learning. They learn the theories, then apply them to new experiences. We want them to know that healthcare starts with the individual and reaches out through the family and the community. We believe teaching and learning are highly interactive and multidimensional. Students should have a spirit of inquiry and employ critical and reflective thinking. We hope our students will acquire attitudes, cognition, and the essential skills needed to develop the knowledge and behaviors that comprise the professional nursing role. Think like a nurse. This phrase encompasses using elements of focused reflection, written and/or verbal articulation of thoughts, assignments that connect new experiences to existing knowledge, critical inquiry, creative thinking, and nursing judgment. We strive to empower students with clinical reasoning and critical inquiry. These program outcomes focus on the preceptor-student experience. Working with a preceptor is the epitome of experiential learning. Hands-on work using the information learned in class reinforces the lesson. Students must learn bedside manner and how to talk to patients and colleagues. The internet and social media have connected the world and made it a smaller place. Diversity is not a rarity, it is a commonality. We are all diverse. The preceptor will be the role model for professionalism and leadership. We are educating professionals and future leaders. These core classes students are required to complete. Foundations of Knowledge and Theory and Research and Scholarly Inquiry are completed prior to working with preceptors. Principles of Population Health Nursing is completed prior to the residency. Physiology and Pathophysiology, Pharmacotherapeutics, and Health Assessment classes, as well as an on-campus Health Assessment Clinical, are completed prior to the first clinical rotation. Students are enrolled in Diagnosis and Management of Adult and Geriatric Health and Illness in the same semester as the first rotation. Similarly, the semesters that have rotations scheduled include a concurrent class for the rotation. This allows the class learning to enhance the experiential learning. Please review your complete preceptor manual for the qualifications and responsibilities of the preceptor, the student, and the program. If you have questions or issues at any time, don't hesitate to contact us. The preceptor will orient the student. This includes informing the student regarding when they can shadow you and when they should remain out of the exam, the patient flow procedure and clinic operation, documentation and charting requirements, and how the student should introduce themselves. Share your expectations with the student. They need to know how they will be assessed. Get to know the student. Ask about their background, goals, and learning needs. The PowerPoint Adult Education Principles can help you understand how adult learners learn best. We ask our preceptors to create an environment and culture that decreases anxiety and enhances learning, be a role model of professionalism, leadership, and compassion, guide the student in learning opportunities, and respond to indicators of student readiness for increased responsibilities, and then allow the student to grow. The process we request the preceptor follow begins prior to the rotation. Please let us know who your site contract contact is, complete the preceptor paperwork and return the appropriate documents, and complete the Typhon login when you receive the login email. The student should contact you 6 to 8 weeks prior to the rotation beginning. Have a discussion with them regarding your expectation, the site, the patients, the culture of the clinical site, anything that you want a colleague or employee to know before starting at your site. You will also determine the days and hours the student will work with you. As the student begins working with you, introduce them to the providers and staff at the site. Review the learning plan and help the student identify strategies to achieve those learning objectives. Share knowledge and experience during supervisory periods, and meet with the learner regarding abilities, skills, and progress. Remember, you are the expert and the role model. At the end of the semester, review the outcomes with the student and determine if they were achieved. Summarize and discuss the student's performance. Complete the Typhon evaluation survey. If problems arise at any time, contact the student's faculty member or the placement coordinator. Students will have varying levels of skills. Just as the curriculum advances from simple to complex, the student's skills will grow with each rotation. During the first rotation, students will have completed an assessment skills clinical, but they may need to observe those skills completed by the preceptor prior to trying to do them on their own. Let the student gradually increase the amount of direct involvement in the clinician-patient encounter. Allow as much involvement as possible, but all parties must be comfortable with the situation. The student will need greater direction in the beginning. As the preceptor gains confidence in the student's ability, the student may be allowed greater independence. In the second rotation, the student should be comfortable with all aspects of patient examination. They should be more proficient in analyzing data and with diagnosis and management planning. The use of time and resources should be productive. The preceptor may prompt the student less, but direct the focus more. Functions such as teaching or quality assurance activities may be added. Students may participate in the management of more complex cases. In the third rotation, the student should be able to perform all role functions. They should be thorough, efficient, organized, skillful, and have the ability of independent judgment. The student is becoming a professional and should engage in collaboration, consultation, and referral. The student may need preceptor support when the student feels overwhelmed with new functions and responsibilities. Please take a few minutes to review these 6 micro skills for clinical reasoning. I will hold this slide for approximately 1 minute. Now take about approximately 10 seconds on each step to review constructive feedback. Feedback helps learners in a variety of ways. Learners can evaluate themselves, challenge themselves, and correct errors. It is important to remember that preceptors can be learners too. copy of the evaluation form you will complete on the student can be found in Appendix A in the Preceptor Manual. This has been a summary of the AGNP program Preceptor Manual. Please refer to the complete manual for the text in its entirety, including the citations and bibliography. Thank you very much.